A nociceptor is defined as a nerve ending of one kind or another that perceives pain. Nocere in Latin means pain. And you know, doctors have to speak in Latin terms to sound important. So instead of saying pain receptors, we say nociceptors. That's a fact. So we're going to talk about nociceptors. So nociceptors are cell types that are located in various portions throughout the body, both the external body, arms, legs, internal structures of some varieties, mucosa. So they be located in the mucosa of the stomach, mucosa intraorally. And they're also located, nociceptors, pain receptors are located regarding the bone. They are located in the marrow of the bone, and they're located in what is called the periosteum of the bone, which is the covering of the bone, but not located in bone itself. And the periosteum, or covering of the bone, has a more than sufficient great number of nociceptors in them. If you are a dentist, you are well familiar with this phenomenon of nociceptors and how significant a response you get when they are stimulated. You can prove it to yourself every time you do a mandibular block, local anesthesia, through the mouth and to block the inferoalveolar nerve. When you place your needle through the mucosa, you get very little response because there are a lesser number of nociceptors in the mucosa than there are in the periosteum. So when you do your block, you take your syringe with a hopefully sharp needle on the end of it, and when you place it through the mucosa, you rarely get a patient's drawback or response. But if you go a little bit too far and that needle touches the periosteum on the medial aspect of the ramus of the mandible, that is when the patient will draw back. And that is a great example of the response of nociceptors. And it is a response of the mechanical response. There are different types of nociceptors that respond to chemical injury, pressure injury, different types of injury, but the nociceptors in the periosteum are more likely to respond to mechanical injury. And I think that is why they're called mechanoreceptors. But anyway, a nociceptor is very, very interesting to fully understand TMD.